We welcome you back to Channel 6 News as we continue on with our program for today. We're going to find out a bit about SCAN, and joining us today is Mr. David Milligan from SCAN. David, welcome to the program.
Thank you very much.
So SCAN has been around for a few years. I think a lot of our folks remember that it actually got started in the Long Beach area. A group of interested seniors got involved, but maybe you could kind of share the mission and the vision of SCAN for our viewers.
Right. So SCAN has been around for 35 years, founded in Long Beach by seniors that wanted to do more for the other seniors in the community. And from that base, we've expanded into all of Southern California. The mission of SCAN, though, is to help seniors remain independent and maintain their health so they don't have to go to a nursing home. Everybody would rather stay in their homes.
Yeah. This is, of course, that time of the year when everyone is either signing up for the first time or reevaluating their Medicare supplemental programs. And a lot of people are looking at 2013 and saying, boy, I got to make that decision the next few weeks. Into early December is really the cutoff date.
Right.
So people are saying, I wonder what's going to be available for 2013. What about SCAN in 2013? Any changes, anything different or new?
Yeah, well, actually, some very good changes and some new things. We've lowered many of the co-pays in our classic product that we call it. There's no premium associated with SCAN's Medicare Advantage plans, so that's really nice. And many of the co-pays that we would have for hospitalization or outpatient surgery and so forth, we've eliminated a lot of those co-pays. So our core product, our classic plan, gets much better. It's got transportation and gym membership, things like that,
Right.
that a lot of seniors care a lot about.
Yeah.
And then we've got two new products that we're very excited about. One for people with diabetes and another one for people with heart disease. Special programs for those folks to help them manage their condition and save money. For example, our plan for diabetics offers insulin at no copay. So we're trying to eliminate some of the cost barriers to care so that people don't have to, scrimp on something and not get the care or not get the medication.
Sure.
So we're trying to eliminate as many of those costs as we can. So some new products for disease-specific folks that we're really excited about.
Well, it sounds like then people need to talk to somebody, find out more information, and take a look at the changes and see if it works out. If they're with SCAN, continue on, or maybe look into SCAN and making a change.
If you're a SCAN member today, you don't have to do anything. We'll send you out the information about the improvements to your plan next year, and you don't need to sign up for anything. You're already a member.
Doing nothing keeps you on the same plan.
That's right, exactly. If you are not on SCAN and you'd like to take a look at it, we offer community meetings. We've got representatives throughout, South Orange County that'll come to your home and help you assess whether SCAN's a good fit. It may be a great fit for some folks. It may not be for other people, and we'll happily tell the story either way.
Right. So it sounds like you've got a great plan, but you briefly mentioned some of those other benefits as well, some things in addition to SCAN, like the gym membership. I know, I guess it's in a way it's in the interest of those folks involved to help us stay healthy by getting some exercise.
Right.
Is really a preventative, the apple a day and the treadmill every day as well, maybe.
There you go. And of course, the logo of SCAN is the apple. So we certainly believe in preventative services. And yeah, gym membership is a really nice service for people. Helps them maintain flexibility. We can hopefully eliminate, the falls and things like that can really cause, a lot of damage in somebody's life.
Right. It used to be they said, don't exercise because you're going to hurt yourself. That has changed so much the last several years, and now we have very active people in the senior area now, very marathon runners, triathletes, all kinds of stuff.
Absolutely. But then at the other end of the scale, we offer a transportation benefit. For some people who maybe aren't as mobile, we will give them rides to their doctor's office visits, to the pharmacy, to maybe physical therapy, things like that. So, we're trying to serve all the needs of seniors.
Yeah. It's interesting because this is literally a homegrown product. As you mentioned earlier, started in Long Beach. I think about a dozen seniors kind of got together and came up with the concept. It grew, and now it's, as you said, throughout all of Southern California.
Throughout all of Southern California and into Northern California now, Arizona as well. But the nice thing is our roots are right here in Southern California. Our service department is right here in Southern California. So when you're calling SCAN service, you talk to a live person, and they're located in your time zone, and they're not in Florida or some other, or overseas.
Yeah. That's a real plus. I know a lot of people like that ability to be able to speak to a live person and B, somebody who's going to be aware of what's available right here in Orange County for them. And then I would imagine you have a list of hospitals and doctors and medical groups that you work with.
That's right. We work with all the major medical groups, down in South Orange County, Monarch and St. Joe's and Memorial and those, so Greater Newport, and of course Saddleback and Mission Hospitals. So yeah, our network, I think, it's very rare when somebody would ask about, is there a doctor on our plan, and it wouldn't be on the plan.
Yeah.
Real rare.
A lot of doctors today, you say, what plans are you with? And they said, well, we're with pretty much all of them. So they all pretty much know they have to be involved to,
that's right,
to be a part of medical care these days. If folks want more information, we have your number on the screen, 981-7346. They can call, get more information, speak to you or one of your coworkers, and get an updated information. Find out when the next seminar is going to be locally.
This is the time of year to do it.
Yeah.
Folks have between October 15th and December 7th to evaluate their options on Medicare.
Right.
And that's when everybody on Medicare across the country is looking at their choices.
It's one thing that I think a lot of people find confusing as well, and perhaps just the way it's set up, because each plan is localized. I think there's, about 4 or 5 pages of plans right here in Orange County, but somebody that you have a friend who maybe lives in Tennessee probably has a different mix of plans, and so what's working for them isn't going to be available to you here in California.
Or even in the county next door to us could be very different, let alone another state.
Yeah.
So they really do need to evaluate their options, and we can help them do it. It's confusing. I tell people, look, to really understand Medicare, you really should take a college course, because it's that confusing.
Yeah.
But our folks are experts, and they can really help people to understand their options.
Again, if you want to find out more, give them a call. That's a local call, 981-7346. And David, thank you for joining us.
Happy to be here. Thank you.
Good to have you with us. Thanks for being with us today. Again, that's SCAN, and again, an option that you might want to consider as you make that important decision between now and early in December as to your supplement to your Medicare health care. We'll be coming right back with more right after this time out. Stay with us.
All my friends are getting up there in age, and we don't talk about cars and girls anymore. We talk about medications and operations.
Everybody's on edge about what could take place in the future.
But SCAN is there to help us with what needs we might have.
Because they care, they try to get better every year.
For 2013, I'd definitely say it's much better. That's incredible.
SCAN Health Plan, better benefits, better services, and better care.
This is good. I like this.
Free annual wellness exam.
0 for tests and x-rays and lab work.
They also have a physical fitness plan where you can join a gym, but
0 is a good number.
SCAN is really the only place that I can think of where you call and actually get to talk to a person.
SCAN is the total package. You don't have to go anyplace else.
You go to a company that cares and has a big heart, you got it made.
To attend a SCAN meeting or to speak with a SCAN representative, call 1-877-212-7226. SCAN Health Plan.